So I got a patient who is 43 years old, who is genetically over the years she has lost her hair. So she's also did SMP, so that the contrast of the hair loss is not that much, so it looks like as if she's got hair. She did not do with me, she did in another clinic. And then now, after doing all the blood profile, everything, which appears to be normal, do not have any medical background of anything, but do have a genetic history of hair loss. So today, all ready to get hair back. So I'm giving her a chance today to take the hair from the donor area and put it in the area that she's lost hair. First time in my life, over my 25 years of experience as a hair restoration doctor, patient said, "Doctor, I want to shave and do my hair." Oh, I said, "Are you sure?" She said, "Yes, I want it shaved, I will wear a cap, I like to have short hair, and I'll proceed to have my new hair." So it's going to be bye-bye to all this hair which she kept over the years, because she's going to opt for completely shaven FUE procedure done by me, Dr. Inder, and a team. So, okay, are you ready for your procedure? Ya, so kenapa macam ini dia nak botakan semua? Nak cakap sikit dah, sebab semua perempuan mereka memang tak nak botakan, hanya lelaki.
Dia go up
Ya, so it's okay lah, sebab bukan kata botak dan botak bro, botak kamu akan easy to work, easy to take care, and then easy, actually very easy for doctor juga for procedure, sebab doktor tak payah, you know, when we want to do female pattern hair transplant, hair loss, kami nak mesti nak tepikan terus satu-satu. So this one is actually a fantastic idea, but of course women do not want to go bald. In your case, you don't mind. So it's a very good way to do also. So congratulations to you. Thank you for choosing Dr. Inder team to do your procedure today. Terima kasih nak. Okay, kami nak start dah. Okay. Yeah.